first one is directed to Ms. Chan. Would you please tell us what your greatest accomplishments were in the California Legislature and how you will use that experience as a county supervisor?
Okay, some of you know a little bit about my record in the legislature. I was the first female majority leader, and I was very proud to have also served as the chair of the Health Committee. I talked a little bit about health earlier, but some of my biggest accomplishments I'm very proud of. I passed over 55 bills when I was there, and about 20 related to health care. You'll see in my flyer, one of the bills I passed, AB 356, was the bill that blew the whistle on Anthem Blue Cross. It was the bill that said when an insurance company was going to raise rates, that they had to give consumers 30 days. And that's what actually alerted not only California, but Washington. So I'm proud to have played that role in healthcare reform. I also passed a bill that prevented hospitals from overcharging the uninsured. This took me 5 years to pass. And we became the first state in the nation to have a bill that says that you can't charge uninsured people more for services than you charge someone with insurance, because it used to be arbitrary. You could go in, you could have some big cut, and you could come out with a $12,000 bill. I mean, there was no rhyme or reason. So that went into effect. I also passed some of the toughest environmental laws in the country. We became the first state to ban chemicals in furniture and in rugs that are cancer-causing, particularly to women and to children when they get in the breast milk. And I also did a lot of work on education that I'm very proud of, stopping the cuts to higher education and passing a number of K-12 laws, like putting nutrition education into the schools and supporting small schools. These things are all relevant to the county because 2/3 of the county budget is healthcare, social service, and children's services. So all this experience I have at the state will help me be able to understand how to implement some of these programs at the county level, but also the direct knowledge of the budget and contacts I have in Sacramento will help the county. I know that there's not a pot of money up there that's just sitting there for us, but we do have to fight for every dollar we can get from the state. Whether it's money that's passing through from the federal government that's being held up there right now because bureaucracy, because the legislature and the governor can't figure out who should give it out. For instance, there was this $6 million a year pot of money for First Five down here for mental health assessment of young kids. It took them 9 months to get that out of Sacramento because of bureaucracy. I know where all that money is. I know people in the administration. I know our legislators. So I will fight for every piece of that money to come down here more quickly. And I think that's really, really key. There is new money in the federal health care bill for home visiting programs in Alameda County. We need to get that money here. So while the budget is bad, there are pots of money that are sitting there that aren't being taken advantage of. I will bring those money to the county. I will bring that money to San Leandro, San Lorenzo, Alameda, and Oakland, so that District 3 residents don't have to suffer as much as they will if the state budget continues the way it is. So I have a wealth of experience at all different levels. I was a school board member too, so I still love the schools. And I'll use all that knowledge to really help this district.